as a public health professional who wears many hats and fulfills many roles, how do you avoid burnout?
Oh, that's such a good question. It's really hard. I will
Yeah,
be transparent that it's difficult because public health is so broad. And if
yeah,
you are someone that is invested in the just overall health of communities and larger populations, you may, like myself, find yourself just diving deep into
yeah,
kind of everything that really aligns and is adjacent to it. So, like, I'm experiencing that currently with some organizing around Palestine, where I'm just like
yeah,
going at 150 miles per hour, and
yeah,
what I've had to tell myself is I cannot be involved in everything. And there are things that sometimes I have to decline to preserve myself.
yeah,
And just again, going back to rest is resistance, is reminding myself that in the rest, it's not only that I'm resting to come back to be better at the work, I'm resting because I deserve rest.
yep,
I'm
absolutely,
resting because my ancestors didn't have the opportunity to rest. I'm
absolutely.
resting because work was forced upon my ancestors.
Mhm.
And rest is not a luxury, it's a human right
Yep,
as a person. And oftentimes, what I find too is when I do have the opportunity to rest, I come back to the work with a fresh set of eyes and
mhm.
ideas, and I'm able to work through some of the problems um, that I had prior to resting. And then after I rest, I realize they're not necessarily problems because I have a different strategy and a different outlook to those things. So, um, we want to stay away from burnout when it comes
Yeah,
to the cause. Burnout is not going to get us anywhere faster. In
yeah,
fact, it's going to delay our process into getting to the destination that we're working to get to. And I think society has really put hyperproductivity on a pedestal. And
mhm.
I think a lot of that is intentional and by design, and that when we are resting and we take a break and we step away from the work, we are able to really dig deep into the most imaginative parts of our mind to
Mhm.
rethink what um, society has created. And that's really, I think, our work as public health professionals, is to look at these systems of oppression, whether white supremacy, patriarchy, um, all of the things, and look at how we reimagine the world for our communities and different populations, whether we're focused on the immigrant population or the elderly or young people or whatever it is. And I think you're doing yourself a disservice by not taking breaks and falling into the traps of capitalism by burning yourself out.
Yep,
That's what the system wants. The system wants us to burn ourselves out. The system wants us to continue to prop up these healthcare systems that don't work. But when I take
yep,
a break and I have time and I step away and I come back, I feel more like I feel more myself to be able to take the
yeah,
work head on. I feel more able to look at the different structures and say, hey, this is not how it's supposed to be. And really the goal in I think resting at an individual level is to allow populations the ability to rest as well. And
mhm.
when I say that, it's we want to alleviate populations from having to worry about when they're getting their next meal. We
Yep,
want to alleviate populations' worry about being able to afford medications. And when we sit in a position where we are able to live what we want for our populations, we're able to direct the system in getting to that place better, because we have to know what we're striving towards, right?
Mhm.
I think when we talk about overall health equity, we're talking about everybody having an equal opportunity and chance at life. And I look at, what are the people who are in that 1%? What are they experiencing? What are their day-to-day lives? And what is it that we want to introduce and show to other populations that their lives have been absent of because of all of the systems that I've talked about? And I think a lot of that really is freedom. A lot of that
Yeah.
really is rest. So we need to embody that so we know where we're taking people and what
Yeah.
journey we want to get to and what destination that is. And that is for me to be able to, look at different populations, whether it's people doing active physical labor. I'm in Mexico right now, so I'm thinking about the indigenous folks that
Mhm.
are breaking their backs to make sure that I have what I need while I'm here. And what I want for them is freedom. What I want for
Mm.
them is rest. So I think that was just a long way of saying that in order for us to get to where we need to get, we can't be burnt out
Yeah.
on various different levels. So I think we need to start changing the narrative of me being hyper productive and in grind mode all the time
Mhm.
as this positive thing, where it's like, I think we should really uplift balance in our lives. And that's what we
Yes.
should really be promoting and celebrating, is the person who has balance, right? The
Yeah.
person who has the ability to get things done, but then also escape for a week and you don't hear from them. But
Yeah.
the work is still accomplished, the work is still
So
there, and
true.
they're going to get back to the work. So yeah.
Such a powerful statement and such a great way to transition. Such a great way to end our interview.